Our population is mainly migrants who come down from the mountains, people who leave the mountain villages to have better living conditions here outside the city. These people unfortunately have to suffer a lot because on the mountains they don't have the basic conditions. They don't have too much access to education, healthcare, electricity, potable water. Behind me is a typical house, if you can call it a house, it's a room, how people start when they come down from the mountains to settle around the city. And what we try to do is to be a bridge, trying to bridge the people who have just come down from the mountains and help them to settle in the city. Anything that can give another opportunity for the people to improve their income, we are interested in it.
Health Bridges International is an organization that grew out of experience working in Peru for over 15 years. And what we realized was that resource and need were oftentimes not matched together. And rather than create an organization that's goal was to build another clinic or to facilitate another feeding program, we could actually create collaborative opportunities for organizations that were working in country, that were already facilitating programs for the poor, to find resource in North America or in Europe to make their projects and programs that much more profound. And our work with Father Alex is literally to help him run the projects and programs that he currently has in place. Part of that method is bringing people down. Every summer we lead a large team, and many of the participants in our team are repeat visitors to Peru. This is a parish. But under that, like any good steward of this community, Father Alex quickly realized that if people are hungry, if people don't have their basic healthcare needs met, you can't reach them from a spiritual perspective. Here, the idea is that we learn to serve others and to create peace in that process.
The area for which I'm responsible has got about 30,000 people. As one of the activities that we have a kitchen at the moment serving around 650 meals every day, reaching to the very poor. If I were to think how many people out of the 30,000 would need this food, it is probably around 5,000 people. There is the social worker that goes and does a family visit, and then after writing a report, people are enrolled in this program. There are these distribution points, and people go and pick up their food from there. In the case of the elderly or people who cannot come out of their house, what we do is with the van, then they do the Meals on Wheels system, where food is left in the houses. Another activity that we have is to try to give the opportunity for the people to stand on their own feet. And for that reason, we have a number of skill training programs where we have therefore people who receive training, and they can be courses of a big variety. It can be like food preparation, it can be beadwork, it can be woolen products, and also some wood carving and wood turning. And those things we sell outside of the country so that they have a proper income for what they do.
Over here will be the intake area.
We said we'll need a place for them to just like basically fill prescriptions and like count pills and stuff like that. So just a table for them to like sit at.
Right now. Right.
Alright, I got it.
¿Tiene fiebre?
Also, we have a clinic. It started with just a little parish thing, just a small room, but it's about 6 years that we have the clinic. We have almost all the specialties there, all the attention. And only last year, 2007, we attended over 22,000 patients. But having said that, we always have new people coming down from the mountains. We are thinking also of having another facility so that we can give a better attention to the people in that which is healthcare.
Más importante, in circulo, in circulo, 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 circulo. Todos ustedes, basta? ¿Hay más? Por supuesto, aquí.
I think the survey and the laboratory specimen collection can all be done in a 45-minute time period. You know, it's difficult to make sweeping analysis since there isn't good data available in the country to sort of ascribe growth, height, weight to age numbers or variables. Maybe the next step is for the Ministry of Health to reinvest in creating good information.
No mires. No mires. Mira allá. Mira al gringo. No, tienes miedo. Ok, señora. Y las últimas preguntas. ¿Usted piensa que José está bien? Más o menos. ¿O mal de salud? Bien. Bien.
Alto is just one small part of the city of Arequipa, over 1 million people. How many people live in poverty like this?
The circle is growing and growing and growing and growing around the city. Besides that, as you can see, there is some progress happening. There is electricity here. There are some main lines where people pick up their water. It takes time, but eventually it will develop. They will have paved roads, they will improve also in their houses, you know, little by little. And we believe that this is the way that we can change the world, you know. You start from Alto Caima and then you keep on reaching interesting people to come down and serve. And hopefully one day they can be anywhere in the world where the need is there, no? So by giving the message of service, we really believe that we can make a difference in life and we can build peace on earth.
Our goal is to bring resources, and we do that by bridging with other organizations. How we bridge is by addressing needs in communities and then building a bridge to the resource. Ultimately, HBI is only as good as our in-country partners. Someday, people won't have to stand in line with their buckets to be able to provide water for their families. And that someday can be made a reality much sooner with a donation from you.